Welcome to Key into Quality, a Mayo Clinic podcast focusing on healthcare quality trends and solutions. Today, we have a special episode featuring two distinguished guests who are turning quality assurance training in the healthcare setting upside down. Thanks a lot for joining us. I'm Dr. Tim Morgenthaler, a professor in medicine here at Mayo Clinic and vice chair of Mayo Clinic Quality. Sheri Nemec is our co-host. Sheri?
Welcome, everyone. I'm Sheri Nemec, Consultation and Relationship Manager for Quality at Mayo Clinic. I liked how you said upside down because today we're going to be talking about a model that's being used to deliver quality improvement training at Mayo Clinic to our staff.
Yes, so our guests are in the process of implementing a flipped classroom approach to our Quality Academy, which involves providing the instructional content before class and then using the class time for more interactive hands-on activities. This method is really trying to enhance the learning and practical application of quality improvement training. Why don't we get into it?
Let's do it.
Yeah, so please join me in welcoming Dr. Moreno Franco, the Chair of Critical Care, and Sandy Booth, Director of Strategic Projects and Quality Improvement. And let me just, first of all, start by welcoming both of you. Welcome to our show.
Thank you so much, Dr. Morgenthaler and Sheri. It's a pleasure to be here.
So today, as I mentioned, we're sort of diving into this somewhat innovative approach into quality improvement education called the flipped classroom model. Dr. Moreno Franco, could you start by telling us a little bit about yourself, and then we'll get into it more?
Yeah, thank you so much. So I'm the chair for critical care medicine in Florida, and I serve in the Quality Academy in two roles. I'm an enterprise associate medical director, and also in Florida in particular, I'm the site medical director for the Quality Academy.
Okay. Tell us about the Quality Academy. What is it and why do we have it?
Well, the Quality Academy was started in 2006, and it's Mayo's way to organized the delivery of effective and cohesive quality improvement education. And the main purpose of the academy is to have a comprehensive training plan. And that includes more than 20 different courses. We have several levels of certification that people can achieve throughout their career. And the education can be tailored to either individuals or group, depending on their particular needs. And our aim is to enhance not just the knowledge, but the skills of different healthcare professionals to ensure that they're equipped to deliver sustaining quality improvement activities. And the advantage is that we're also going beyond just the technical aspects into the culture aspects. So the Quality Academy, it's indeed playing a role building our safety culture, our quality culture, strengthening our continuous improvement mindset. And all of those activities really culminate with a culture of excellence across Mayo Clinic.
So tell us then, how did you get into this concept of the flipped classroom approach?
Well, the story is actually interesting. It starts back when I was a critical care fellow, and I came to Mayo Clinic full of many hopes after training my medical school in Panama and internal medicine in Cook County Hospital and Rush University. And the truth is, beyond learning critical care, what I really learned was there was a whole different way to deliver healthcare. And that different way had its center in quality improvement methodology. I was very fortunate because at the time that I was starting my critical care training, our program had just started that same year the Quality Academy classes to achieve levels of certification, initially in bronze and then in silver certification for quality. And that also included to do projects. And we as fellows had to sit down for 90 minutes listening to one of those typical never-ending lectures about how to use quality improvement methodology. So really, I mean, I was able to see how beautiful quality improvement was to help us achieve what we needed to achieve beyond patient care. The next year, I became the chief QI fellow for my program. And that's when I imported this idea of changing things because clinically, I know how busy we were and we couldn't just, sit down for 90 minutes. And the flipped classroom model was actually an answer to be able to complete our quality improvement training as we continued to adhere to other clinical research and education responsibilities. We were actually very fortunate because the Quality Academy was flexible enough to say, yeah, let's try something else. I mean, in the spirit of quality improvement, right? And we tried this new format in which we inverted the traditional learning by using content delivery ahead of time, either videos, reading, etc. And that allowed the students, in this case, the fellows, to spend the time more wisely. So when we came to classroom, it was more about the interactive sessions, the hands-on activity, and really the practical applications of how do we solve the problems that are in front of us. And with that, we were very effective at not only completing the projects that we had set out to do, but really we were able to get everybody trained and comfortable using the quality improvement methods, so much that we were also able to put out a paper after that initial couple of years to explain how the critical care program was able to incorporate quality improvement training into their curriculum.
Wow. And those were some pretty exciting times, just bringing all the pulmonary critical care medicine fellows into the quality fold and seeing all that activity. And so many of you have gone on to leadership roles just like yourself. Sandy, could you just introduce yourself and tell us how this model's been implemented in your quality improvement training program?
Yes, I'd be happy to. Thank you. Well, as you mentioned, I'm the director for the Quality Academy, but previous to Mayo Clinic or healthcare, I actually spent the majority of my career in the finance industry. That's where I received my formal Six Sigma Master Black Belt training and certification. And then transitioning to Mayo Clinic about 15 years ago, and shortly thereafter, I met Dr. Moreno Franco. He was one of my first project assignments before I moved into the education shield.
I wouldn't want to
And
be you.
yeah,
He's a project.
I was I was very fortunate to make that connection with him, and we've really worked on and off together since that time. Now we're formal partners on the leadership team of Quality Academy, both at that enterprise level and supporting Mayo Clinic Florida locally. But I think the one thing that we've really enjoyed doing together all these years has been that flipped classroom presentation model development of our learners. And while we've had other teams and departments participate in this program, our repeat customers have been primarily residents and fellows. We're so fortunate to see the positive results that have come out of the learner population because the educational content that we're providing leads to this practical application through project work. So our learners are able to understand and apply these QI tools during the program. And really, many of their projects have received recognition through our fellows program that Dr. Moreno Franco mentioned earlier. They've gone on to present their scholarly work at various conferences, and even some have gone on to publish their QI work. So we are really excited that this program provides a collaborative learning environment where teams are excited, right? They get engaged in the work that they're doing. And then ultimately, they have a better retention of this educational information they received because it's being reinforced through each session. We don't look at this as kind of a one and done. We really hope that they take this on, what they've learned and what they've experienced throughout their careers.
Dr. Moreno Franco, give us a little bit of sense of some of the specific activities or exercise you use during those sessions.
Yeah, thank you, Sheri. And just like Sandy mentioned, we have really evolved over time. I was telling you earlier about how we started the first flipped classroom training, and that was in Rochester when I was a Chief QI Fellow. After coming to Florida in partnership with Sandy, really Sandy has been instrumental to help us to continue to improve, do several PDSA cycles, to use some QI terminology, to continue to enhance the way we deliver and offer our education. In that regard, for example, there were years, or there was a specific year in which we tried to do the training all across all different Mayo sites, and we learned how not to do some of that, or what things wouldn't really work remotely and what really needs some more intentional focus and site leadership and some champion locally to make it happen. So from the things that we've learned over the years, some of the key elements to answer your question, Sheri, that we do is, number one, the team that comes to training, it's a multidisciplinary team. We have fellows, we have nurses, we have respiratory therapists, we have advanced practice providers or even advanced practice providers in training. And I gotta tell you also, we invite our administrators. In our latest cohort, for example, we have one of our operations manager being part of that. So we feel this is very important because it doesn't matter which role you play at the institution, for you to be able to speak the language of quality improvement, but most importantly, to be able to know how to apply those concepts into a project is extremely valuable. So we then ask those teams to be part of the project selection process. So they come up with their own ideas. The truth is we end up usually with more ideas than teams. So we also teach them about impact, effort, prioritization. We have a matrix that we use for that. And then the teams get engaged on their own work. So we've learned how to pace them so that they're separate team meetings in which they're actually doing hands-on work, and then come back to the flipped classroom so we can mostly talk about the different aspects of definition of the project, the metrics, the analysis, what implementation ideas they have, and how they're going to go about implementing. There's a lot that needs to be done in terms of not only quality improvement, but implementation science, looking at the evidence-based medicine aspects, what should be applied where. And then those conversations become really, really rich. And I think this is really the magic where adult learning occurs. You have individuals that are truly having conversations about which barriers they're facing, how they're trying to solve it as a team. And then some of us that have the advantage of having been in quality improvement for many years, in healthcare for many years, in leadership roles, understand the institution, then we can offer them some specific ideas of how to think through it, how to change their mindset, or how to change the framework, or how to change the metric, how to move around so they can continue to make progress. And we're also very fortunate because we have clinicians that are engaged as mentors. We have clinicians that serve just as a subject matter expert, and we have clinicians that serve as QI sponsors or experts for that team. So all that recipe, if you will, then allows these real QI projects to come to life. And they execute problem solving when we come to class. We talk about systems thinking. We talk about collaboration. We actually, help reinforce that collaboration. In the teams, there's always somebody who may be struggling, how to bring them along. So all those things are learned there. As an example, one of the recent projects that we completed recently, or our teams completed recently, was a pressure injury reduction project in the ICU. And we're all very familiar with the things that change during the pandemic. When we look at some of our metrics, particularly the pressure injury metrics, those were actually a lot higher than before. So we had to do a whole project about, hey, what is causing that? What do we need to do to improve it? And I'm very happy to say that with that group's work, particularly some of the nursing leadership that participated on that, they were able to achieve very, very important, remarkable reductions in pressure injury in our ICU. So this hands-on approach really reinforces their learning and helps them develop the practical skills to get the projects done.
And I would imagine that when talking with other organizations too, it's so hard to get people out of the practice to be able to go in and do training. And I would imagine that this creates a lot of buy-in for not only the clinicians, but leadership as well to invest in something that's going to benefit, right? The outcomes of quality or a practice. Again, the ROI part, you
Yeah,
don't always want to go to that, but I think it's an important piece.
yeah. No, you're absolutely right. Sandy can attest to this. I mean, every year we face different challenges, right? And time constraints is usually a significant one. But we're fortunate that our program directors for the different programs, we have critical care medicine, we have pulmonary critical care medicine, we have neurocritical care, and we have the neurology residents as well. So these are some of the groups that we do routinely. We're fortunate that those program directors have actually a buy-in into this, and they understand that a little investment in time actually pays big dividends. And I'm sure Sandy could also comment on how she's been able to help us export the flipped classroom model outside to other practices as well.
Yeah, you've mentioned so many improvements we've done over time, Dr. Moreno, Franco. In addition to that, I think it was really about creating the support that the learners need, right? So really embedding these clinical experts and QI experts onto each of those multidisciplinary teams has gone a long way. But also you mentioned time, right? So we've learned over time that it's so precious. And unless we were really helping these teams hardwire some regularly scheduled project meeting, that time to meet, to maintain that momentum, they wouldn't be able to really drive their projects home in a timely manner. We've also implemented more one-on-one time with the QI mentors. So meeting with the teams and offering ourselves at any time during the program, even after the program is over, to our learners, really, again, to make them successful, but also to help the teams have successful projects with sustainable outcomes after the projects are done. So we continuously improve after each iteration of the program. But I think the biggest win for our department was that standardization of this offering. So some of my colleagues and I were offering this year over year, kind of dusting it off and reinventing the wheel each time. And when we realized that there was such an appetite for this approach, we took a step back. We standardized the offering. We created a framework for the program that is still very flexible, but it includes about 6 different sessions with the, like I said, the mentoring in between there, where the deliverables are presented throughout the 6 or 8 months, depending on what time frame the teams want to work under. We provide the educational deliverables up front. So it's all very structured, yet flexible, because again, we're trying to meet those learners where they're at. And so really building up the support they need on the teams with the projects, scoping them properly, and then laying out a timeline has really taken the program to the next level.
I want to ask the two of you, this is wonderful work that you're doing and you're inspiring these young learners. And it isn't only the young learners, because you're bringing people in on all these multidisciplinary teams at all different levels of their careers and so forth. What are your thoughts on how that really does contribute to the culture that you're developing there at Mayo Clinic in Florida?
Tim, that's an excellent question. So we view culture at Mayo Clinic in different ways. So I think we're fortunate that you start with an institution that is already more than 160 years in history, and that is rooted in very important values. And those values, we do a lot to try to sustain them over time. So we're starting in a good place. But the reality is that times change and people need to adapt to that change. And the reality is that evidence in medicine and healthcare in general is changing at a faster pace than ever before. So, how do we help our teams still be responsive to those changes, to still deliver the best patient care possible, but be able to execute change? And that is with quality improvement tools. We have gotten significant, positive feedback from the individuals that organize some of these, for example, the program directors. But to me, the most important feedback is when you look at the culture of the unit as a whole. Over time, we've hired physicians that were part of our training. We've hired APPs that were part of our training. And all of that then reinforces the ability of our unit as a whole, our institution as a whole, to be able to then execute those changes in a very scientific way and adhering to quality improvement tools.
Yeah, I would add to that, and that was perfectly said, Dr. Moreno Franco. I think I would add to that when we look across the organization and we see learners who continue to bring others along with them, like you said, in leadership roles, and they have this QI passion or mindset, and they're wanting to spread it amongst their own department, their colleagues, their teams, and as mentioned, bringing others along with them. I think that says a lot about not only QI as a knowledge, but as an application, and really the culture that's embraced these learnings.
Well, this has just been a fantastic conversation. I guess before we wrap up, do you have any advice for other institutions that are looking to implement this flipped classroom model for their QA training programs? Maybe Dr. Moreno Franco, your thoughts?
Yeah, we would recommend number one, don't be afraid. We can start small, use some quality improvement knowledge that is out there, start to use the time with the teams more wisely to, in that flipped classroom analogy, to be able to transmit that know-how that cannot be learned by reading an article or watching a YouTube video. So that's really what everybody can do. The teams should be encouraged to have buy-in, either by selecting their ideas or working on the impact effort aspects of it. depending on how good the pre-class materials are, that's going to change a little bit the outcome. So if anybody needs help with creating those materials or using some of the existing materials that we have, they can feel free to reach out to the Quality Academy, Sandy, or myself, so we can provide some guidance about the training and the methodology. But overall, don't be afraid to try it. As long as you provide the framework and the adequate support, the participants really are the ones that do the magic. And I think that's where you'll see that the results will improve over time.
Wow. Sandy, anything you want to add?
Yeah, I think it's important to set expectations early on. So there's a shared understanding about deliverables and time commitments specifically. I think it's important also to use feedback to enhance the program as we've mentioned here. But I think most important, organizations should be flexible. They need to be able to tailor this flipped classroom model to meet their own specific organizational or departmental needs. Again, it's about the learners. We want to meet them where they're at, and as much as you can, include storytelling as an instructor about your own experiences, because that'll go a long way.
Thank you both so much for sharing your time with us. First of all, thank you for that. And please accept our gratitude for sharing your insights and experiences with us today. I mean, it's just been a great pleasure having you both here.
Thank you so much for having us and the invitation. We appreciate it.
Thank you so much.
So, as we wrap up, just some observations. A strong culture of quality in healthcare, I think, is just so tightly bound to the sustained investments that an organization makes in education and training of their workers. Quality education equips healthcare professionals not only with technical expertise, as Dr. Moreno Franco mentioned, but also with shared values and behaviors and problem-solving skills that just reinforce an eye for safety. They reinforce accountability. They reinforce that spirit of continuous improvement. And over time, that really builds a culture where excellence is expected. Dr. Moreno Franco made mention of the culture of excellence. Learning becomes continuous. The systems are designed to anticipate and prevent harm. It's kind of a win-win-win, but it does take that investment of time, and you need enthusiastic champions like Sandy and Dr. Moreno Franco. So thank you both again. Thank our listeners. It's the end of our podcast. We're glad you could join us. Again, Mayo Clinic's Key into Quality podcast aims to highlight some of those first steps in addressing important quality challenges in your organization. Our goal is to improve quality for patients and the populations that we all serve. If you enjoyed this podcast, we'd be grateful if you left us with a review on Apple Podcasts, a rating on Spotify, feedback wherever it is that you listen. You can also follow us on your favorite podcast platform. Let others in your organization know about this podcast so the information can be spread. Until next time, goodbye.